Hello and welcome to my mini video series. I'm Laurence. I'm a certified nutritional practitioner and health coach. I specialize in PCOS because I have PCOS, and I do recognize that there is so much need for education and for a lifestyle change and different approach to PCOS, because PCOS is a long-term, lifelong condition, but we really do need to manage it in that sort of way that supports our body, because we can heal and reverse our symptoms, but we really need to focus on the root cause approach. This is what I'm all about, really focusing on, what is your specific case and how can really we target those root imbalances so that you can actually heal your PCOS, not just today, but over a lifetime by managing it holistically. So what is PCOS, polycystic ovarian syndrome, most common hormonal disorder among reproductive women, affecting about 5 to 6 million women in the US and about 10 million women worldwide. We do think that the number is higher though, just because of misdiagnoses, and also because there's a lot of women out there who are not being treated properly and who are just unaware that they have PCOS. So it is a disorder that is associated with hyperandrogenism, high male sex hormones, and anovulation, which means you are not ovulating or you are ovulating irregularly. So it is a diagnosis of exclusion. This means that you do need to look into other conditions and rule those out before you can diagnose PCOS. So these could look like hypothyroidism, thyroid disease, hyperprolactinemia, so hyperlactin levels, functional hypothalamic amenorrhea, and adrenal tumors. So you definitely want to do the proper testing, check with your doctor to see if it could be anything else, because there are a lot of symptoms that can overlap and look similar to PCOS. So we definitely want to rule those out and obviously get the right treatment. So PCOS is the most common cause of infertility in women, and it's said to affect up to 20% of women of childbearing age. And it's a syndrome with many signs and symptoms. So not every PCOS case is going to be the same. Every person is different, but also PCOS cases all look different too. So you can be more lean PCOS, more overweight, more of the issues with menstrual irregularities or hirsutism, acne, hair loss, all those kinds of things, and you might have different clinical features too. So we really want to be aware of that and remember that not every PCOS case is treated the same, and we are not all the same either. And this is where the holistic approach really works well, because we look at the whole person, their triggers, their imbalances, their history, etc., to make sure that we are addressing them as a person and not just a PCOS case, because we can't just copy paste. The majority of women, about 75% of PCOS women don't ovulate, and infertility is actually 10 times more common in women with PCOS, and it's responsible for up to 90% of ovulatory disorders, which is quite a lot. Clinical features that you can see, there can be central obesity, but it's not mandatory. Obviously, you can have lean PCOS. Amenorrhea, anovulation, those are all common. You can see anovulatory infertility, so issues conceiving due to not ovulating, maybe even some cervical mucus issues or egg quality. It really depends. And then hirsutism or acne or hair loss, these are all symptoms that are common because of the high androgen levels. And then polycystic ovarian cysts. So basically these aren't real cysts, these are undeveloped follicles. They are characteristic of PCOS, but not mandatory. Then you want to look at lab testing. So usually we're going to see some abnormal levels on your lab tests. So this could look like elevated androgens, so like the testosterone, elevated LH or FSH. You can also see insulin resistance with high insulin levels. There are other tests as well, but definitely want to do fasting insulin. And we can also see abnormalities on ultrasound. So like the polycystic ovarian cysts, which aren't real cysts, as I mentioned, they're going to look like a string of pearls on the ultrasound. This is characteristic of PCOS. It's not a determinant. We do need to look at several factors. And for the PCOS diagnosis, basically there are some conflicting views, but the Rotterdam criteria is usually the diagnostic criteria that we follow. And this looks at 3 factors. You need to have 2 out of the 3 to be diagnosed with PCOS. So basically number 1 is irregular or missing periods. Number 2 is excess androgens, either on blood tests or clinically. So, if you have the signs of acne, hirsutism, hair loss, then that could definitely fit into that. And ovarian cysts on ultrasound, they are not real cysts, they are polycystic cysts, as I mentioned before, so the string of pearls. So you need 2 out of those 3 to be diagnosed per the Rotterdam criteria. But I do see a lot of women that don't have polycystic ovarian cysts, so we really need to be careful with that and not just looking at the ovaries because it's definitely not a determinant for PCOS. And of course, you want to work with someone who's going to give you a proper diagnosis, who knows what they're doing so that we can actually get the right treatment. With PCOS tests, there are a few that I usually look at. I'm going to send you guys a guide in the newsletter email where you can click on. It's a free guide with testing I usually recommend looking into and the optimal ranges, because optimal ranges are not the same as normal ranges. We do really want to be conscious of that and making sure that we're looking at the optimal ranges. So prolactin levels, you want to look at LH, so luteinizing hormone, FSH, follicle stimulating hormone, fasting glucose, fasting insulin. We want to look at fasting insulin as well. A lot of people just do the glucose. That's not enough. There are other markers too, but definitely those 2 minimum. A lipid profile, so with the cholesterol, etc., and ultrasound. So as I mentioned before, you want to do the pelvic ultrasound to see if you do have those string of pearls. And DHEAS, it's another androgen made by the adrenals, as well as progesterone, and a full thyroid panel. Really, really important to do a full thyroid panel that includes the antibodies, etc., because this is going to be really important to assess how your thyroid function is doing, which it's usually good to be low functioning or compromised or dysfunctional in PCOS cases. So I hope this is useful for you to kind of understand where to start with PCOS, definitely getting a proper diagnosis, and check out my free guide in the link in the newsletter, and there you can see all of the tests. Tomorrow we'll be talking about food, some of my favorite foods for PCOS, and how to navigate eating with PCOS.